My name is Dr. Paula Danda. I'm the founder and medical director of Worldwide Healing Hands. I'd like to begin with a story. Close your eyes and imagine that a baby is born. The baby is not breathing. There is no one to help the baby. The baby dies. Imagine that another baby is born. The baby is not breathing. You are there to help the baby. You rub him dry, keep him warm, and help him to breathe with a bag and mask. The baby begins to cry. At every birth, there must be a skilled person to assess the baby and help the baby who is not breathing well. With this training, you can make a difference. We will teach you to be present and prepared to help a baby who does not breathe. It is your job to promote cleanliness, warmth, and breastfeeding for all babies. Every year, more than 1 million babies die at birth because there is no one there who can help a baby who does not breathe. Training in helping babies breathe gives birth attendants the skills to reduce these deaths. Helping Babies Breathe is an evidence-based educational program to teach neonatal resuscitation techniques in resource-limited areas. We believe that assessment at birth and simple newborn care are things that every baby deserves. The initial steps taught in helping babies breathe can save lives and give a much better start to many babies who struggle to breathe at birth. The focus is to meet the needs of every baby born. Our objective is to train birth attendants in developing countries in the essential skills of newborn resuscitation, with the goal of having at least one person who is skilled in neonatal resuscitation at the birth of every baby. A key concept of helping babies breathe is the golden minute. Within 1 minute of birth, a baby should be breathing well or should be ventilated with a ventilation bag and mask. The golden minute identifies the steps that a birth attendant must take immediately after birth to evaluate the baby and stimulate breathing.
Hello, I'm Christine and I'm a gynecology nurse practitioner.
And hi, I'm Isaac. I'm an operating room nurse.
Number 1, begin by introducing yourself to the mother.
Hello, I'm Christine. I'm the midwife. I'm going to be taking care of you today. And you must be the birth companion.
I am.
Perfect. Nice to meet you.
Nice to meet you.
Hi, I'm Isaac. I'm one of the nurses. I'll be taking care of you and your young one. Very nice to meet you. You must be the birth companion?
I am, Isaac.
Very nice to meet you as well.
Nice to meet you.
Congratulations.
Number 2, identify a helper and review the emergency plan. Emergency planning should be a part of every birth. Mother's birth companion can call for help as directed and observe the mother's condition.
So you're the mother's birth companion?
I am.
Perfect. If anything should happen, I'll tell you exactly what to do.
Very good.
Number 3, wash your hands and ask the helper to wash their hands. Hand washing prevents infections. Everyone who attends a delivery, including the mother, father, and birth companion, should all wash their hands. Clean gloves also help prevent infection and protect the birth attendant from blood and body fluids. Number 4, prepare the area for delivery. The birthing area should always be clean, warm, and well lighted. You will need the following items: soap to wash your hands, a plastic sheet to put under the mother if there is no clean area, clean gloves, cloths to dry the baby, a suction device, scissors or a clean blade to cut the umbilical cord, string to tie the umbilical cord, a stethoscope, and a ventilation bag and mask. Number 5, prepare an area for ventilation and check your equipment. The area for ventilation should be clean, warm, and well lighted. It should also be flat, dry, and safe, without risk of falls or other injury.
Christine, when should a skilled person be present at a birth?
A skilled birth attendant should be present at every birth because you never know when a problem will occur.
And when should you wash your hands?
You really need to wash your hands before and after caring for the mother or the baby.
We recommend you pause the video and perform the following exercises. Work in pairs to prepare for birth. One person takes the role of the skilled birth attendant, the other takes the role of the helper. Then switch the roles and repeat the exercise.
Checklist. Introduce yourself to the mother. Identify a helper and review the emergency plan. Prepare the area for delivery. Wash your hands. Prepare an area for ventilation. Assemble all supplies and equipment. Check the mask and bag for ventilation. Part 2. Next, we will demonstrate what to do at the birth. Note the time of birth. Dry the baby thoroughly. A wet baby can easily become cold and have difficulty breathing. Remove the wet cloth. Place a clean, dry cloth on the baby. Meconium. A baby may pass stool, called meconium, before birth. Meconium in the amniotic fluid may be a sign that the baby has experienced stress before birth. Meconium inhaled into the lungs can cause breathing difficulties.
If there's meconium, first clear the airway. Suction the mouth first, then the nose with the bulb suction. Dry the baby thoroughly. Remove the wet towel. Place the clean, dry cloth on the baby.
If a baby is not dried, but she's placed on a cloth beside the mother, what happens?
The baby can become cold.
What can happen when a baby inhales meconium?
The baby can have breathing problems. Most babies cry at birth. Crying means the baby is breathing well. The baby who does not cry needs help to breathe. About 1 out of 10 babies need help to breathe.
If a baby cries after birth and then breathes quietly and regularly, what should you do?
Give the baby routine care.
A baby is not crying at birth. He is not breathing or moving and is limp. What should you do?
Provide the baby with help to breathe. Without help, a baby who does not breathe may suffer serious injury or die. Routine care. A baby who's been dried and is crying can receive routine care. Keep the baby warm. Position skin to skin and cover head and body. Check for breathing. Clamp or tie and cut the cord. Cleanliness is important to help prevention of infection. Infection of the umbilical cord can lead to serious infection. In some regions, antiseptic solutions may be applied to the cord. Wait 1 to 3 minutes after birth to clamp or tie and cut the cord of a healthy baby. Place 2 ties or clamps on the cord, cut between the clamps or ties. Leave the cut end of the cord open to air. Position the baby skin to skin on the mother's chest to encourage breastfeeding.
What can you do to encourage breastfeeding?
Keeping the mother and the baby together encourages breastfeeding.
How long should you wait to clamp or tie and cut the umbilical cord of a crying baby?
If the baby is crying, wait 1 to 3 minutes to clamp or tie and cut the cord. We recommend you pause the video and practice the following exercises. Work in pairs with the mannequin to practice the steps in routine care. One person takes the role of the birth attendant, the other person gives the response of the baby and acts as a helper when needed. Then switch the roles and repeat the exercises.
Checklist. If meconium, clear the airway. Dry thoroughly. Recognize crying. Keep the baby warm. Check breathing. Clamp or tie and cut the umbilical cord. Place the baby on mother's chest to encourage breastfeeding. If you notice bleeding from the umbilical cord, even though a tie is in place, what should you do?
Place another tie between the first one and the baby's skin.
What actions help to prevent infection of the umbilical cord?
Good hand washing, wearing clean gloves, cutting with sterile or clean scissors. Part 3. What is the golden minute? A key concept of helping babies breathe is the golden minute. With 1 minute of birth, a baby should be breathing well or should be ventilated with a bag and mask. The golden minute shows the steps that a birth attendant must take immediately after birth to evaluate the baby and stimulate breathing. Delay in starting ventilation may cause serious injury to the baby. If the baby is not crying, clear the airway and stimulate breathing. Keep the baby warm, position skin to skin and cover with cloth. Position the head, extend the head slightly. Clean the airway, use a bulb suction to gently remove secretions from the mouth, then the nose. Suctioning too deeply can cause injury to the baby's mouth and throat. Stimulate breathing by rubbing the baby's back once or twice.
How long should it take to dry the baby, clean the airway, and stimulate breathing?
It should take less than a minute, the golden minute.
What happens if you suction for a long time or suction too deeply?
Too much suctioning can keep a baby from breathing. What should you do if the baby is not breathing well after drying? Clearing the airway and rubbing the back once or twice.
The baby needs ventilation with a bag and mask. Which baby is breathing well? A baby who is breathing quietly and regularly, or a baby who takes one deep breath followed by a long pause?
The baby that is breathing regularly.
Part 4. Next, we will demonstrate the ventilation of a baby. Move to the area for ventilation, a separate area if the cord is cut, on or beside the mother if the cord is not cut. Stand at the baby's head. Select the correct ventilation mask. The mask should cover the baby's chin, mouth, and nose, but not the eyes. A mask with a round or pointed shape may be used. When using a pointed mask, the pointed part fits over the nose and the round part fits over the chin. Position the head in a slightly extended position. Position the mask on the face to form a seal between the mask and the face. The encircling method. Use your thumb and the first finger to form the letter C around the top of the mask. Push down on the mask with the first 2 fingers. The other fingers should lift the chin and jaw up towards the mask. Pushing down on the mask without lifting up on the chin and jaw can flex the head and block the airway. Make a firm seal between the mask and face while squeezing the bag to move the chest gently. You should see the chest moving with each ventilation. If the chest is not moving, make sure the head is positioned correctly and you have a good seal between the mask and the face. Check for leaks by feeling where air escapes against your hand. Give 40 ventilation breaths per minute. There must be time for the air to move out of the lungs between breaths. You can count aloud.
Pause the video and practice ventilating the baby. Position the head. Note the effect of the correct and incorrect head position on the chest movement. Position the mask on the face. Make a firm seal while squeezing the bag to move the chest gently. Give 40 ventilations, breaths per minute.
What allows you to move air into the baby's lungs during ventilation?
A good seal between the mask and the baby's face is very important.
To help open the baby's airway, how should you position the baby's head?
The baby's head should be slightly extended. A baby who requires close monitoring, shallow or irregular breathing, grunting, chest wall retractions, or indrawing.
If you are giving a baby ventilation with a bag and mask and the baby is gasping, what should you do?
You should continue ventilation.
If a baby begins to breathe well after 30 seconds of ventilation with a bag and mask, how will you care for the baby?
Monitor the baby closely with the mother. Pause the video and perform the following exercises. The golden minute ventilation. Work in pairs with the mannequin to practice the golden minute. One person takes the role of a skilled birth attendant. The other person gives a response of the baby and acts as a helper when needed. Then switch the roles and repeat the exercises. You should be prepared to take care of a baby who has clear or meconium stained amniotic fluid, does not breathe after clearing the airway and stimulating breaths after brief ventilation. Checklist. If meconium is present, clear airway. Dry thoroughly. Recognize not crying. Keep warm. Position head. Clear airway. Stimulate breathing. Recognize not breathing well. Clamp or tie and cut the umbilical cord. Move to an area for ventilation. Stand at the head. Select correct mask. Ventilate by 1 minute. Recognize breathing well. Monitor with the mother.
Part 5. Call for help. If the baby is not breathing on its own, call for help. Ask for a skilled helper if available. Improve ventilation if the chest is not moving. Head. Reapply the mask and check for leaks. A common place for leaks is between the cheek and the top of the nose. Reposition the baby's head. Keep the head in the correct position by lifting the chin and jaw up and forward while pressing down on the mask. If these steps do not improve chest movement, continue to the next steps. Mouth. Clear mouth and nose of secretions and open mouth slightly before reapplying the mask. Opening the mouth and lifting the jaw up and forward help prevent the tongue from blocking the airway. If these steps do not improve chest movement, continue on to the final step. Bag. Squeeze the bag harder to give a larger ventilation breath. If the ventilation bag has a pop-off valve and even more air is needed, close the valve and ventilate again with caution. Look carefully at the chest for movement. Decrease the amount of air entering the lungs if the chest moves too much.
Pause the video and practice. The action plan. Calling for help, improving ventilation, head, reapply mask, repositioning head. Mouth, clear mouth and nose of secretion. Open mouth slightly. Bag, squeeze the bag harder. A baby does not breathe after brief ventilation. What should you do first, Christine?
The first thing you should do is call for help.
A baby's chest does not move with ventilation. What should you do?
Reapply the mask to the face and reposition the head with the neck slightly extended. Part 6. Evaluate the heart rate after 1 minute of ventilation. The earliest sign that the lungs are being expanded with air is a rapid rise in the baby's heart rate. This cannot be seen. It requires feeling the umbilical cord pulse or listening to the heart rate with a stethoscope. Next, a baby will show improvement in color and muscle tone. The color will become pink. The baby will move and no longer be floppy. Finally, a baby's own breathing will begin.
Checking the heart rate. Feel the umbilical cord pulse or listen to the heartbeat with a stethoscope. Simulate the heartbeat by tapping out the pulse with 2 fingers. Decide if the heart rate is normal or slow. Normal should be more than 100 beats per minute. Slow should be less than 100 beats per minute.
You are breathing for a baby with a bag and mask. When should you check the heart rate?
You should check the heart rate after 1 minute of ventilation.
If you feel the umbilical cord to count the heart rate and you cannot feel any pulsations, what should you do next?
You should listen for the heartbeat with a stethoscope. Part 7. This is what to do if the heart rate is normal. Continue ventilation at a rate of 40 breaths per minute. Look for chest movement with each ventilation. You can stop ventilation when the baby is breathing well on its own and the heart rate is normal. Continue to monitor the baby and the mother, checking for breathing, heart rate, color, temperature, breastfeeding. What should you do in this following situation? If a baby has been ventilated for more than 3 minutes with a bag and mask, the heart rate is 120 beats per minute, the baby is not breathing, what should you do?
Slowly decrease the rate of ventilation and watch for breathing.
If a baby has been ventilated for 10 minutes with a bag and mask and the baby is now breathing and has a heart rate of more than 100 beats per minute, What care does this baby need?
Close monitoring with specialty consultation or referral. Part 8. This is what to do if the heart rate is slow or the baby does not breathe. Continue ventilation. Ventilate at a rate of 40 breaths per minute. Look for chest movement with each ventilation breath. Improve ventilation as necessary. Replace the ventilation bag if necessary. If there is no heartbeat or the heart rate is less than 60 beats per minute, begin chest compressions.
Location. Pressure should be applied to the middle third of the sternum, just below an imaginary line drawn between the nipples. Take care not to apply pressure to the xiphoid process. Thumb method. Encircle the torso with both hands and compress the sternum with both thumbs side by side while the fingers support the back. In very small neonates, the thumbs may be superimposed. Use just the tips of your thumbs to compress to avoid squeezing the whole chest wall and fracturing the ribs. Two-finger method. This method is used if the resuscitator's hands are too small to encircle the chest properly, or if access to the umbilicus is necessary for medications. The middle and the ring fingers of one hand are held perpendicular to the chest and the tips apply pressure to the sternum while the other hand is used to support the back from below. Pressure. Use just enough pressure to depress the sternum 4 centimeters, then release the pressure to allow the heart to fill. One compression consists of the downward stroke plus the release. Rate. To match the heart rate of a normal neonate, the compress release action should be repeated 120 times per minute, 2 per second. Cautions. Do not remove the tips of your fingers from the chest. You may waste time relocating the compression site and end up compressing the wrong area, producing broken ribs with the possibility of a pneumothorax or a laceration to the liver. Every 4th compression is dropped to allow ventilation between the compressions.
Breath.
1, 2, 3.
Breath.
1, 2, 3.
Breath.
1, 2, 3.
Breath.
1, 2, 3.
A few babies will not begin to breathe on their own, or will continue to have a slow heart rate despite good ventilation with a bag and mask. Continue ventilation while activating the emergency plan. Evaluate heart rate and breathing. Check the heart rate at 5 and 10 minutes after birth. If you are performing chest compressions, check the heart rate every 30 seconds and stop chest compressions when the baby's heart rate is above 80 beats per minute. Seek advanced care. Even with access to advanced care, some babies may not recover. Recognize maceration. Maceration indicates that a baby died long before delivery. If a baby dies hours or days before birth, there will be changes in the baby's appearance. These changes, called maceration, include purple discoloration of the skin, peeling skin, and stiffness of the arms and legs. Ventilation can be stopped when maceration is recognized.
You have provided ventilation with the bag and mask for 5 minutes. The baby's chest is moving, but the heart rate is about 70 beats per minute. In this situation, what should you do?
Continue ventilation, activate the emergency plan, and seek advice from a specialty facility.
After 10 minutes of ventilation with good chest movement, the baby's not breathing and there's still no heart rate, no cord pulse, no heartbeat by stethoscope. In this situation, what should you do?
Stop ventilation. The baby is dead. Part 9, advanced care. Have a plan in place to arrange consultation and referral. Note phone numbers to activate the emergency plan. If transfer is necessary, transport mother and baby together. Keeping mother and baby together supports breastfeeding. Continue skin-to-skin care as this facilitates close observation and protects the baby from cold during transport. Support of the family is important. Help mother to express breast milk for a baby who is ill. Birth attendants should be aware of cultural beliefs and practices. Provide information to the family in a culturally appropriate way. Respect the faith and cultural practices of the family when a baby dies.
A baby needed ventilation with bag and mask. She's breathing fast and cannot breastfeed. What should you do in this situation?
Explain the baby's condition to the mother and birth companion.
A premature baby will be taken to the district hospital with breathing difficulty. How should you advise the mother?
Advise her to go with the baby if possible. Pause the video and perform the following exercise. Continued ventilation with normal heart rate. Work in pairs with the mannequin to practice continued ventilation with a normal heart rate. One person takes the role of the skilled birth attendant. The other person gives the response of the baby and also acts as a helper when needed. Then switch roles and repeat the exercise. You should be prepared to care for a baby who has poor chest movement, has a normal heart rate and breathes well or does not breathe well.
Checklist. Recognize not breathing and poor chest movement. Call for help. Continue and improve ventilation. Recognize if still not breathing well. Recognize a normal heart rate. Recognize breathing well now or still not breathing well later. If breathing well, monitor the mother, or if not breathing well, continue ventilation and seek advanced care.
Part 10. Clean and test your equipment after every use. Store clean equipment in a safe place where it can be easily accessed. Disassemble the ventilation bag and mask device, and if possible, the suction device while still wearing gloves. To decontaminate, soak all parts in a 0.5% chlorine solution for 10 minutes. To clean, wash all parts with soap and water. Rinse with clean water to remove all soap. To highly disinfect or sterilize, boil in water for 10 to 20 minutes or soak in activated glutaraldehyde, then rinse well with boiled water, or steam autoclave for sterilization.
In conclusion, mastering the action plan. The action plan serves as a framework for your approach to actual cases. Your knowledge and skills will quickly decrease unless they are used, so it is important to continue to practice your skills. Practice by tracing the appropriate path through each of the 6 cases. Work together to analyze cases in which babies need help to breathe.
Mastering the action plan. 1. If meconium, clear airway. Dry thoroughly. If baby is crying, keep warm and check breathing. If baby is breathing well, cut cord and give routine care. 2. If meconium, clear airway. Dry thoroughly. If baby is not crying, keep warm, position head. Clear airway, stimulate breathing. If baby is breathing well, cut cord and give routine care. 3. If meconium, clear airway. Dry thoroughly. If baby is not crying, keep warm, position head. Clear airway, stimulate breathing. If baby is still not breathing, cut cord, ventilate. If baby is breathing well, monitor with mother. 4. If meconium, clear airway. Dry thoroughly. If baby's not crying, keep warm and position head. Clear airway, stimulate breathing. Baby still not breathing, cut cord, ventilate. If baby's still not breathing, call for help. Continue and/or improve ventilation. If baby is now breathing, monitor closely with the mother. 5. If meconium, clear airway. Dry thoroughly. If baby's not crying, keep warm, position head. Clear airway, stimulate breathing. If baby's not breathing, cut cord, ventilate. If baby's still not breathing, call for help. Continue and/or improve ventilation. Baby still not breathing, continue ventilation. If baby has normal heart rate and is now breathing, monitor closely with mother. Number 6. If meconium, clear airway. Dry baby thoroughly. If baby is not crying, keep warm and position head. Clear airway, stimulate breathing. If baby is still not breathing, cut cord, ventilate. If baby is still not breathing, call for help. Continue and/or improve ventilation. If baby is still not breathing, continue ventilation. If the baby has a slow heart rate or normal heart rate and still not breathing, continue ventilation and give advanced care.
With this training, we know you can make a difference. Thank you for being a part of our effort to save mothers and babies worldwide.